Portland's neighborhoods are distinctive. Each one is a village, part of a community. Tucked into one of Portland's lovely old neighborhoods is an unexpected resource, a health clinic for people who have limited access to affordable health care.
Of course, the Hispanic population, we have Russians, Vietnamese, Chinese, Somalis, Middle Eastern, Kurdish, Iraqis, Afghanis.
The diversity of historic Multnomah Village requires a unique style of health care. Since 2005, the Southwest Community Health Center has been a medical home for ethnic minorities and others in the metro area who don't have health insurance.
Are you taking any blood pressure medication currently?
Chris Verkamp is uninsured. Suddenly unemployed, he returned home to Portland to learn a new trade.
The clients we see are the working poor. A lot of them have jobs, but they don't have insurance through their employers, or they don't make enough money to be able to buy their own health insurance. So we're serving the people that fall through the cracks.
Joanne Guzman is a patient. She lives just around the corner, but didn't discover the clinic until she was referred here by a social worker at Providence St. Vincent Medical Center. The ongoing care is just what Joanne needs.
She said, don't worry about the money. And so I did pay what I had to pay, but she was really helpful.
Joanne lost her job 2 years ago. A caretaker for her mother and an invalid brother, she was ignoring her own symptoms to save money.
Yet I ended up making a bill by being taken to emergency at St. Vincent's, but I had no choice. It was my life.
Last year, the center's 12,500 patients were spared that expensive choice and the serious consequences of urgent care.
For diabetics, foot amputations, blindness, we're making sure that their sugars are in control.
The paid staff here is small. It's the 170 volunteers, including 90 physicians, who keep the safety net tight. Providence has paid the bills since the day Samira shared her vision with Sister Linda Thompson.
That's what the Sisters of Providence have always done. They have always worked in collaboration with local people, wherever they were, who said, we got an idea, come and help us do it.
Nurse Susan Mornian trains and supervises the medical student volunteers. During her 8 years at the clinic, she's seen some residents become doctors and continue to volunteer here. Susan does callbacks and acts as an advice nurse.
There's the language of caring that just comes right out of you. That's what I see patients can understand. And for me, this is a mission, and it does feel close to my heart.
Caring for people is the neighborly thing to do in Multnomah Village, with Meals on Wheels providing food and Neighborhood House offering social services. The health center has taken its place along Capitol Highway. The clinic's motto, "A healthy community is a strong community," reminds Sister Linda of her predecessors who opened the region's first hospital. Another vision made a reality by resilience and compassion.
Sisters would be very happy here. I know they are.
Happy and proud of what's happening in Multnomah Village. For Providence, I'm Mike Donahue.